Assessment of pulse by palpation and assessment of respiration. Check medical order or nursing care plan for frequency of pulse assessment. More frequent pulse measurement may be appropriate based on nursing judgment. Perform hand hygiene and put on PPE if indicated. Identify the patient.
Good morning, sir. I am Robbie, your caregiver for today. Can you please identify yourself by confirming your name and your date of birth?
My name is Briz and my date of birth is on November 25, 1995.
Perfect. Thank you so much, sir.
Close curtains around bed and close the door to the room if possible. Discuss the procedure with patient and assess the patient's ability to assist with the procedure.
Okay, sir. I will be getting your pulse rate for today.
Put on gloves as appropriate. Select the appropriate peripheral site based on assessment data. Move the patient's clothing to expose only the site chosen. Place your first, second, and third fingers over the artery. Lightly compress the artery so palpations can be felt and counted. Using a watch with the second hand, count the number of pulsations felt for 30 seconds. Multiply this number by 2 to calculate the rate for 1 minute. If the rate, rhythm, or amplitude of the pulse is abnormal in any way, palpate and count the pulse for 1 minute.
You have 60 beats per minute, sir.
Note the rhythm and amplitude of the pulse. While your fingers are still in place for the pulse measurement, after counting the pulse rate, observe the patient's respirations. Note the rise and fall of the patient's chest. Using a watch with the second hand, count the number of respirations for 30 seconds. Multiply this number by 2 to calculate the respiratory rate per minute.
You have 18 breaths per minute, sir.
If respirations are abnormal in any way, count the respirations for at least 1 full minute. Note the depth and rhythm of the respirations. When measurement is completed, remove gloves if worn. Cover the patient and help him or her to a position of comfort.
Please relax yourself, sir.
Remove additional PPE if used. Perform hand hygiene.